Hello everybody, I'm Dr. Khyati Shah, an obstetrician and a gynecologist. This is part 2 of my PCOS series. As I explained, PCOS affects you from your head to the toe. It can have varying symptoms like hair thinning, acne, irregular menses, heavy menses, something called acanthosis nigricans, which is basically darkening of the nape of the neck. And I've explained its complications, which is why it's important to take your health seriously and start taking active efforts. If you have all these symptoms, you should definitely visit a doctor. Now I'm going to talk about what to expect when you go to the doctor for PCOS. When a patient of PCOS comes to me, I will take a detailed medical history. That means I will specifically ask about your menstrual history. When was your last menses? How long does your menstrual cycle last? And how irregular is it? How frequently do you change your pads? All of this is very relevant to me. I will also ask about family history, which basically means if your sisters or your mother is suffering from the same disease, there is a high likelihood that you have the same. If you have complaints of infertility, that means that you've been really trying to conceive a baby and have failed to do so, we will elicit a detailed history for the same. If there are any associated other illnesses, we would like to talk about it too. I would like to examine you as well. That means I will record your height, your weight, your BMI. I would also like to take BP because in patients of PCOS, there may be an associated component of hypertension and diabetes. I would like to do a general examination where I'm looking for acne or any excessive hair growth on the face. I would also like to do a local pelvic examination to check for abnormalities. Now, there will be a confirmation of my diagnosis where I would like to do some blood tests. I would like to check your hormone levels where I check for estrogen, progesterone, testosterone. Any imbalance in this will lead me to the diagnosis of PCOS. Now, as I had explained in my previous video, PCOS is linked with insulin resistance and diabetes. So it's very important that we check your sugar levels. I would also like to check for your thyroid levels because hormonal imbalance can probably be because of imbalanced thyroid levels. Now, a very important test is sonography. The name Polycystic Ovary Syndrome is because on sonography, the ovaries have multiple cysts. Cysts means a fluid-filled sac. So, the ovary is filled with such sacs and the ovary is unable to release the egg. Such a sign can be seen on sonography. After I have confirmed my diagnosis, it's very important that I would like to discuss with you a personalized treatment program for you. Now, I would like to discuss some basics that you can do from your end that will definitely help you on your PCOS journey. Lifestyle changes are super important. It is said that even 5% weight loss can help you regularize your menstrual cycle. Now, the weight loss should be target oriented and goal directed. You should be self-motivated to make certain lifestyle changes. I would first like to talk about diet. Now, there is no specific diet according to studies that has helped. I would like to advise to go for a sustainable diet and you should go local. That means you should have locally available vegetables in your diet. Now, as a thumb rule, you should have less carbs, no refined sugar, and replace those carbs with more proteins, more vegetables, more fiber. Now, your plate, you should divide your plate into 4 halves. 1/4 should have carbohydrates. 1/4 should have vegetables. 1/4 should have proteins and the other left 1/4 should have curd. When I say that you should go on dieting, that does not mean to starve yourself. Dieting does not mean to abstain from food. Rather, you should make smart decisions and eat right. So, have a balanced meal which covers all your macronutrients and your micronutrients and supplements you to have a happy and an energetic lifestyle. Now, hearing all of this seems amazing, but replacing your old habits seem difficult. So, go slow. If you are having 4-5 chapatis and hardly some sabzi, reduce your number of chapatis and increase the quantity of your sabzi. If you want, you can replace the chapatis to bhakris. Millets are an excellent source of fiber, calcium, zinc. Plus, they are complex carbohydrates, so they take time for absorption. Now, regarding exercise, you should do 150 to 300 minutes. That basically means around 3 to 5 hours of moderate to intense exercises per week. That can include swimming, jogging, pilates, strength training, whatever suits you, whatever makes you happy. As long as you're sticking to the program, you have to remember that you should be treating your body well. All of these changes will definitely help you in your PCOS journey. Now, depending on your lab reports, the doctor would like to add either birth control pills, either sugar pills, or if you have symptoms of infertility, we would like to work on the same. This is a very individual approach. So you should definitely consult your doctor to give you a treatment protocol for you. Now, I would like to end this video by suggesting that PCOS is just getting more and more rampant. Obesity is an epidemic. You should choose what to do with your body and treat your body well. Lifestyle changes is something that we all say and we all hear about, but it's time to take it seriously. Thank you. We'll see you again with another such interesting topic. Bye.